In this video, I'm going to show kinesiology taping for generalised lumbar spine pain or generalised lower back pain. We're using 4 eye strips. You don't have to use different colours. These are for demonstration purposes, but you can if you like. So we've got 2 strips that are about 4 to 5 squares and 2 strips that are more 3 to 4 squares. But this will depend on the size of your client. Obviously, the taller your client or the more area you wish to cover and support, the longer your strips will have to be. We've rounded the corners off. This just prevents the tape from peeling so it can stay on a little bit longer. Tape usually lasts around about a week, but we say try to keep it on between 5 and 7 days. So start your client in a seated position. And then we're going to roll the top up and just pop it underneath the top there. And as always, we take off the backing strip on the anchor. We're going to start at the bottom of the spine, around about the sacroiliac joint. And then we're going to ask the client to slouch forward. So we're going to try and put the erector spinae muscles on stretch as much as possible. It's quite hard to, some people find it quite difficult to flex their spine, their lumbar spine. So we're going to add about 25% stretch as we move up the erector spinae. And then there will be no stretch on the last bit of the tape, which is called the anchor. Using the backing paper, the back of the backing paper, we can then just rub the tape, use a little bit of heat to secure the tape to the skin. And I'm going to repeat this on the other side. This can help reduce pain, creating that lift of the soft tissue. So again, using the anchor with no stretch, pull the tape to allow the backing tape to become loose so we don't have to touch the adhesive. Fold the backing strip over on the part that's going to become the anchor. The client's going to slouch down slightly, and then we're going to add 25% stretch, moving the tape up the back and then releasing the tape at the top. Just ensure the whole tape is stuck down, and if you are massaging before you apply the tape, ensure you've taken all of the massage medium off. You can use alcohol rub, you can use wipes, just make sure that there's no medium on. So now we're going to apply the transverse strips. We're going to put 2 of these across. This time we're going to rip the tape in the middle, fold over a part of it so you've got an area that's going to be able to stick to the skin. This is going to go into the middle over the spine's processes between the 2 parts of the tape that you've already stuck down. So as low as you can go, just around about L4, L5, maybe even onto S1, depending where the client's feeling the most amount of discomfort. So here you can see that stuck, and then we're going to use that middle part as the anchor, and then we're going to increase the stretch on either side. The anchors are going to then be on the outside. So again, fold the tape over, add 75% stretch as you move laterally, and again ensure the tape is stuck down so it doesn't peel off. And the same for the other side. So we're going to pull the backing off, fold over for the anchor, 75% stretch, over, no stretch on the outside, and then again ensure the tape is stuck down. So that's one transverse strip. And then we're going to perform the other one a little bit higher up. So often the TL area, thoracic lumbar area, is often an area of tightness or an area of discomfort. So we can focus the tape to decompress that area. So again, ripping in the middle. The anchor is going to be actually on the spine's processes. And then pull the backing off, fold for the anchor, 75% stretch. Using the backing tape, ensure it's stuck down. You can always rub it over at the end as well to ensure that the whole tape is stuck. 75% stretch for the other side, and move laterally, and then no stretch on the outside there. If you've creased the tape and you want to take it off, make sure you take that whole strip off and then reapply it. Don't be tempted to peel it off, get rid of the crease and then reapply it. Use the backing strip to help maneuver the tape rather than actually holding the tape and holding the adhesive. So this is a taping technique using kinesiology tape for generalised lower back pain, supporting the lumbar region, or maybe even the lumbar sacroiliac region, depending on how far down you put the tape, and then also the thoracic lumbar region, supported with this transverse strip. When we have applied the tape, we've asked the client to slump to pop the erector spinae on stretch, as we've applied 2 eye strips longitudinally and 2 eye strips transversely.